Let's talk about flexibility. In preparation for the surgery, flexibility is very important because, again, we're stretching everything out, so everything tends to get tight. So the more flexible you are before surgery, the easier and better results you will have during the procedure. One of the things I tell people is to make sure that when they're standing with your feet straight and you're able to bend down, you should be able to touch the floor. If you could even palm the floor, it's even better. That shows how flexible your hamstrings are. The flexibility in your ankles, well, obviously you gotta be able to dorsiflex, which means your ankle comes up. So the more flexibility you have in your calves, again, the easier it will be for you. So that's one thing I want you guys to work on prior to your surgery. Make sure you're nice and flexible, so when you do the surgery, you'll have no problems at all. All right, so let's talk about how much your weight affects the procedure. Well, if you are over 175 pounds, it may be a bit too much weight for the precise nails to handle. Even though you're using most of your weight on your hands when you're using a walker and getting around, there are still times that you put too much weight accidentally or unconsciously that the nail is not going to be able to handle that weight. And what that could cause is, one, it could cause the nail to break, or it can stop the internal mechanism from working, so the nail will stop lengthening. So you got to make sure when you're ready to proceed with the surgery that you try to lower your weight to around less than 170, and the less that you weigh, the better it is and the safer it is. So get on that treadmill and start trimming yourself and get lean and get ready for the surgery. I've had a lot of people ask me questions about complications from the height lengthening procedure. So just to quickly go over, just like with any other surgeries, there are risks that include infection. There's a risk of developing blood clots, as well as post-operative compartment syndrome. So compartment syndrome is when you bleed into your legs a little bit too much and it cuts off the circulation because of the pressure. So that's a medical emergency. And now that we're in our new office and right across the street from the hospital, it makes it very easy that if something like that is starting to develop, we could run over there and take care of it right away. This usually happens within the first 24 hours after surgery, so that's one of the main reasons of staying in the hospital, to make sure that that doesn't happen. And we take all precautions to make sure that you don't have any complications, including making sure that you're up and walking for circulation purposes, monitoring your blood pressure, and giving you special medications to reduce the bleeding and swelling after surgery. So we haven't had any major complications in quite a long time, and we hope to keep it that way. But just in case, right across the street to take care of it. If you do have questions regarding additional complications or specific questions regarding any events that may happen after surgery, please reach out to us and I'll be happy to answer your questions. So one of the most common questions I get asked regarding the height lengthening procedure is, when can I get back to driving? And generally what I say is that it takes about a month to a month and a half before getting back to driving. Purpose for that is because it takes some time for the body to recover from the initial surgery and let the swelling and everything to reduce down to a point where you can actually move your legs. The first couple of weeks is really tough, but after that it slowly gets better so that you could move your feet to use the pedals. The most important thing is obviously to be able to use the brakes, and you want to be able to push the brakes really hard with your legs in order to avoid any accidents. One of the other questions is specifically from the women who ask, well, when can I get into high heels? Usually high heels take a little bit more time. Usually it's about 3.5 to 4 months before you get back onto the heels. And the purpose for that is because you want to make sure that the bones are nice and strong and that you're able to walk without the need of any support. So that usually takes about 3.5 to 4 months before you can get back into heels. So I hope that answers some of the more common questions. If you do have more questions, please make sure to reach out to us.